Hancock County has people who are just as devoted and committed to seeing their community thrive, but with fewer resources to work with. The educational levels vary from county to county. The percentage of high school graduates is very descriptive of reflective, if you will, of how well we can do. Our greatest challenges in public health are really, if you focus them back down into basal causes, what is this? I think it's related to, the challenges are related to the level of education and the family income levels, the poverty level. Then, you know, the greater the poverty, the less educated we are, the more challenges we have.
Many of the rural areas in Georgia, probably like most places, have fewer resources of any sort for health care or for social services, just because there's a smaller population. There are fewer smaller hospitals or no hospitals in those communities, and it's hard to have subspecialty care. Certainly in some cases it's hard to have even primary medical care. In some of those counties, the health department may be the only source of medical care, and the health department doesn't provide primary medical care.
We do have some issues going on in rural Georgia that are quite disastrous, let's put it that way. And one is the poverty rate. So if you look at the poverty rate in the country, poverty rate on average is 17%. In Georgia, the average is 19%, so it's a little bit higher, but not that much higher. But if you go down deep into some of our counties, the poverty rate's over 30%.
They're doing it based on a very objective formula based on population and poverty. And they need the money to deal with the people. But they need new money. We don't need to be robbing the poor.